what is the importance to salons of carrying out a dedicated COVID-19 risk assessment? Because there's a huge amount of basically fake news at the moment around the risks to businesses around COVID-19. So can you just kind of fill us all in on why we need to be doing a COVID-19 risk assessment for salons, please?
Do you want me to start with that, or do you? Obviously, there's a legal requirement to have a risk assessment in place, but that's probably not the main reason you should be doing it. The main reason is it's a good process to go through to sort of identify risks that either yourself or your customers are likely to be exposed to, and managing those risks. And the sort of the two main risks are concerned is one is a risk to yourself from a legal point of view, that you could be prosecuted. You can mitigate that fairly easily by doing the risk assessment. And the second one is obviously to your customers and yourselves, which is more of the health risk, which is really the one that we're going to be talking about today. I think the whole risk assessment thing is a relatively straightforward thing to do. It's really about looking at what you do on a day-to-day basis, having a bit of an understanding of the guidance and sort of trying to apply that. And I think we'll probably go through a bit more of that as we discuss this today. I don't know if you've got anything else to add to that, John or Dom.
I guess just to support that, Will, there were sort of four messages that I was looking at today. That I think the first one being around that the government will kind of tell you when you can reopen. It's not something you have to decide yourself or by risk assessment and worry about whether you got it right. It's going to depend on the rate of transmission, the R value, and the reinfection rate. So there will be some guidance about when you can open. I think the second point is that the government will have to provide some kind of how-to guidance to support a risk-assessed approach. So again, you're not going to be shooting into the dark with your controls about not knowing where to start. So I think thirdly, what we can do at the moment is have a look at a risk-assessed best guess based on what other countries are doing. So I think we'll probably touch on Greece, France, New Zealand, what other shops in the retail sector are doing, and maybe something similar on a risk assessed basis with close contact like hospitals. And then I think the fourth point really to make is that a month in COVID world is a long time. So as long as we're sort of following the guidance, tweaking our approach specifically for a salon, then when the government says you can open, you're going to be 90% there. So you just need to make sure you've got your completed risk assessment in place and the controls are ready, and then you're open for business. And I think it's all based around, you know, the key principles that the WHO set out, you know, around hand washing, separation and isolation if you discover symptoms.
Just to add to that, the law on health and safety hasn't changed as a result of COVID-19. It's still a requirement to assess the risks to employees and others who may be affected by business operations generally. And obviously COVID-19 is now very much one of those known risks. And the risk assessment obviously needs to consider a whole range of things, and as we'll probably find out and discuss a little later, is that it needs to cover sort of a whole range of things, areas of people's lives that we've probably not really thought about before. So yeah, it's quite an interesting time, but it's not to be, you know, it's not too daunting. I think the risk assessment process itself, I think it's just being focused and kind of quite pragmatic about things.
And so just to ask what may be an obvious question, should we be doing a dedicated risk assessment for COVID which stands alone to our existing risk assessment documents, or can we simply amend and add to our existing template?
I think it depends really what works best for people. There's no law against that says you should do either. If it works for you to just go through your current risk assessments and look at each process, it depends how you do it and then update it. I think sometimes people find it easier just to do a a COVID one that's specific for COVID, and then just go through the whole process. So that would be the way I would do it, but that doesn't mean it's the way that you have to do it. If there's anything,
I think that focuses the mind on it as well, so it doesn't kind of get lost with other risks. I think that doing a specific one, I've actually had it's a different sector, it's construction, but a client who has had built into his risk assessments, general risk assessments, the controls for managing COVID-19, and he got served an improvement notice by the HSE because they didn't deem it sufficient enough. They wanted a standalone one. So I think the enforcement agencies are kind of, they're learning as well. I don't think they've got their ducks in a row quite properly yet. But you know, I think they're definitely going to be reactive on this rather than proactive.
I think given that you have to brief all your staff on the risk assessment, there's some quite clear government guidance around that on the, I don't know if anyone's seen the poster, then it kind of makes sense to have it separately, because then you can just say, yeah, this is the document we need to make sure everyone's aware of.
Yeah.
And reinforcing your point, John, that, you know, a week in COVID land is a long time. It makes it very easy then to update.
Yeah, absolutely.
Okay, so you mentioned, thanks for that. You mentioned about learning from other countries. What can you guys share with us that we can take from what other countries have been doing with this?
Well, I was
go on. You go.
You start, John. You've done more research on this than me, so you start.
Why don't I say what I found in Greece, and then sort of go from there. I think we're probably working east to west, which is the way that the virus had spread. So WHO guidance is quite clear about a 1 meter spacing, and in the UK we've adopted a 2 meter spacing, and I'm not sure whether that will change over the next month. Just something I think to bear in mind. Greece have set a social distancing between workspaces of 2 meters. Customers are only allowed in following an appointment, so there's no drop-in kind of facility, and I think that's consistent with France and Germany as well. Businesses in Greece, businesses are encouraged to keep a list of appointments. I think that's probably to aid the track and trace testing, so that they can tell where people have been. I mean, you probably do that anyway, and to display that as an audit trail. So I think there's an element of record keeping around the appointment lists. They mandate the use of protective masks for staff and customers. I think we'll talk about that a bit later rather than get drawn into it now. They don't, I'm not sure whether that's masks or face shields, but like I said, we can talk about that in a bit. They also want the use of disposable gloves for all employees in the salons. They set some specific opening hours, which are actually quite long. 7 a.m. till 10 p.m. I mean, I don't know how that stacks up with what people are doing anyway, but it sounds quite long to me. And they've also set a square meterage of to determine occupancy. So they're working on 5 meters squared per person. So 20 square meters for 4 people, and then an additional 1 person for 10 square meters after that. So I think in practice, I don't know if anyone's been to the shops, social distancing is hard. To maintain 2 meters distance when people are not in close contact is difficult. And I think we should be really mindful of that in the way that we set up our premises, and in this case, salons. So really that's what Greece sort of stipulates as you must. So maybe, Will, it's now useful to have a look at New Zealand.
Well, I mean, New Zealand's reasonably similar. I think a lot of these follow the same guidance with the 1 meter and obviously the gloves and the like. I don't really know that there's a lot more to add other than the New Zealand guidance. I thought was quite good. If you go onto the website and if you go onto Google and download it, there's a checklist which I quite liked, which just went through, you know, all the things that you need to consider, from getting staff onto site, getting clients onto site, washing, the actual process that you go through. So I thought it was quite good guidance, maybe as a checklist for yourselves to have a look through.
What we
Yeah,
weren't sure about was whether it had been ratified
yes.
by government or
Mm.
just put forward as a proposed approach.
Well, I
So
think
in the
yeah.
UK, for example, the gym sector have come together and put forward their proposals for how they're going to run that kind of facility after lockdown's released. But there seems to be maybe a few grey areas with government guidance, and the government hasn't released anything specific. So I think that was the only caveat with the international stuff, is that we don't really know how it's implemented.
Yeah,
Yeah, it's very important to remember that it is just guidance and it's not been ratified. So, and it's another country as well. So it's a thing to think about.
And because we're unregulated in both the UK and Ireland, it means that it's likely to only be guidance rather than, for example, Germany, which is a much more regulated industry. And so therefore it is easier for them to legislate. Just as a couple of late attendees, just to reinforce, this is, we're talking right now about what other countries are doing. This is not what we are going to be doing in the UK, because we simply don't know yet what we're going to be doing in the UK or Ireland. So we are simply talking around our potential options. Any other countries you want to highlight, guys?
Yeah, sorry, just picking up on your point there, Gareth, about the guidance and the fact that it is guidance. It's even if it is kind of ratified by the government, it will still, certainly at the moment, and that's what we've seen in 8 other sectors, is that it is guidance. So it's not following the guidance is not necessarily a breach of the law in and of itself, but the reality is that it's there to be followed unless there's exceptional reasons not to follow it. I mean, just to give an example of how far we've come, in 2003, there was a guide issued for businesses around infection control in the workplace. And it said, you know, although your employees may pick up infections from workmates just as they may do so outside of work, those infections are not your responsibility as an employer under health and safety law. And that's always been really the case. But I think COVID-19 now has kind of shifted that a little bit. It's brand new. The reality is that, you know, we have to manage risks from it in a way that we haven't before. And it's clear sort of the way the government are thinking, and the enforcement agencies are starting to shape their thoughts, that the control does fall within the responsibilities of an employer.
Okay,
A couple of other countries, Gareth.
Sorry, just to reinforce on Dom's point. So just to be confirmed on what you're saying there is that as the business owner, we have a legal duty to protect our staff as best we can from COVID-19?
Yes, yeah.
Okay, which is a very, very good reason indeed to do a risk assessment.
Yeah, I mean that's basically how you establish you know, your control measures to do that, is by assessing the risk and seeing, you know, where the main issues are, and then obviously you put your controls in place and then just monitor. But I think we'll probably do a bit more detail on that a bit later, won't we?
Okay, thanks, Dom. Sorry, John, you were going to add another country.
Just a couple of things I picked up from, I think this was Sky News. Germany was only allowing dry haircuts, and with every other chair in use in the salon, and they weren't allowing any talking face to face. And in France, again, it was no walk-ins, and everyone was asked to wear masks, both customers and employees, masks and gowns, and use hydraulic gel and disposable gloves. And it was face shields for employees. So a couple of examples there. I think we've talked a lot about risk assessment. So what we decide to do will be based on our risk assessed view of what we think's right. I think what we see a lot of at the moment is people going maybe beyond what you would deem to be a risk assessed approach. I think Dom had a good example from the garden centre that he went to, you know, over the weekend, where the employees were behind perspex screens, behind face shields and a mask. So you would start to question, well, why have you chosen that particular combination? What risk are you trying to control? And I think that's the really important thing for us, is whenever we make a choice, there's an audit trail as to a particular risk that we're trying to control. We're not just doing it because everybody else is doing it, or we think we should.
I think just the other thing that I'd like to add, and I completely agree with what you've just said there, John. It's really important to make sure that we're assessing our risks and we're putting in reasonable, what's reasonable. That's all the law requires us to do, is what's reasonable. We're not expected to go over and above that. But I think also in an environment where you're working very, very closely with people, it's really important that what you're doing is visible. So I think things like washing your hands and things, it's really important that you do it in front of the client so they can see that you've actually got a procedure and you're doing it. And the face masks and all the rest of it, it shows that you are managing it. So I think that these, sometimes you shouldn't just wear face masks just for the sake of wearing face masks, but I think sometimes it's really important to show that what you're actually doing is very visible, if that makes sense.
Yeah, thanks. Well, that does. And we've had a really good question from D, which is if it's my legal responsibility, can I be sued should a client or a member of staff catch COVID whilst on my premises?
Just typed an answer to that for her. But literally just press send then. But yeah, I think it'd be difficult to prove that, you'd have to establish that link, and also establish that the duty to manage it wasn't being enforced. I think if you're doing all you can and the controls are good, I think it'd be very, very difficult for them to pursue that, to sue you as an employer from it, because there's so many other areas where it could be picked up. So I think
they'd have to also prove it was in your salon, and that's going to be very nearly impossible,
or weren't working. So yeah.
Okay. Thank you, Dom. There's been quite a few questions posted about PPE, and we're going to come on to PPE in some detail in a minute. AJ's asked a question about insurance, and making sure that we have adequate insurance cover to be able to trade once we're allowed to. Have you got any advice in terms of informing your insurance company, sharing with them your risk assessment, making sure there's anything extra you need to add to your policy, or is that something that we each need to take up with our broker?
Yeah, I mean, I think that's definitely something you'd need to take up with your broker. I mean, they should be fairly aware of what's going on, but I think, it wouldn't do any harm to give them a call. I can't think of anything in particular that you'd obviously need to do the risk assessments and make sure you've done all of that. I don't know if there's anything you, John and Dom, want to add to that.
The only thing I would add is that even within the health and safety profession, we've seen differing advice from differing brokers on what they're prepared to accept in terms of level of risk. So I think it's quite a specific thing to your insurer. So definitely, worth a call, isn't it? Or an email.
Yeah, for sure. I mean, my advice for that would be, it costs you nothing to phone your insurance broker or drop them an email. And it could cost you a great deal if you don't. So why not? Quick question from Chris, which is, do you have to do a risk assessment if you've got less than five employees?
Yes, the answer is, but it doesn't necessarily have to be written down. That's the difference. But I think it's good practice to write down anyway, because you can have an audit trail of all the decisions that you've made and why you've made them. So if you decide not to do something, you can document why you decided that, why you made that decision. And I think it's always good practice to write it down.
Okay, I also think that, writing something down like that is good food for thought. And we all want to keep ourselves, our staff and our clients safe. And so by doing it in writing actually makes us think about the process perhaps slightly more than just doing it in our heads.
Yeah, I agree.
It's harder to question an audit trail, isn't it, as well? If you date it and there's a log of decisions that you have made which are specific to yourself.
Okay, yeah, that's really good. Quick question from Rachel, which is, how much responsibility do I have if the staff are all self-employed?
you're still managing the site, you're still managing the area, you're responsible for the premises, so you still do have a responsibility under the Health and Safety at Work Act for the people that are working on your premises. So yes, yeah, you do have a responsibility for them.
Yeah, it's the master-servant relationship, isn't it, kind of thing, for want of a better phrase, but that's kind of how they look at it in legal terms. So you're still responsible for them, even though they're self-employed.
And we have a moral responsibility.
Absolutely, yeah.
And I think one shouldn't discount our moral responsibility as the key holder, for want of a better description, for a premises. We all want to stay safe here, and actually, this webinar is not about not doing a risk assessment or not carrying out the right steps. This webinar is all about trying to mitigate the risk to everybody. And part of that mitigation is a legal one for us, but more importantly than that is actually keeping our staff and clients safe.
I completely agree with that, Gareth. I think with health and safety and with all the legal, people tie themselves up in knots with the law. And I think if you just sat down and thought, I'm a salon owner, I've got a duty of care, and I just want to get it right, you could not bother reading pretty much any legislation, and you'd be most of the way there. I think that's exactly where we need to be with it.
Okay. Thanks, guys. Is there anything else to add on different countries before we come into PPE? Because the Q&A is pinging wildly with PPE questions, and I guess that's probably where we need to move on to shortly.
No, I think hit the PPE, I think.
Okay. So,
Gareth, can I just add one thing before we kind of touch on PPE? I was Dom or Will, were you going to touch on the risk hierarchy?
Yeah, I think that's really important.
I just think that PPE is kind of quite low on the hierarchy. And we would often talk about things we try to do to eliminate the risk first. If we can't eliminate it, then reduce it. And then if we can't, or reduce it to an acceptable level. And then if we need to, we might add further controls, which would normally be where PPE comes in. It doesn't come in kind of at the top. So I think that's important to bear in mind. It's a very important subject, and it's a very easy one to get our heads around, because we can feel that we can do something very easily by putting on gloves or a mask and give ourselves a shield of protection. In reality, we may need to have thought about the layout of the premises and other things as well. So I just want to kind of put that in our minds, that there's very much a hierarchy of how we deal with risk, and PPE tends to be near the bottom. Sorry, I said it, Will and Dom, but Matt,
no,
if you have anything to add.
It's written in the law. The PPE is right at the end of it, so you pretty much do everything you can. You open the door, you ventilate, you do the lot, and PPE is the last thing. But it's just what we're left with a lot of the time. But it really is, you're dredging the bottom of the barrel when you're looking at.
It shouldn't be the first thing that we go to.
No, it's your last resort.
Okay, I think that's really good, strong advice, because stay safe without it, and then you put it on, and you're even safer.
Yeah.
Okay, so just to reinforce, before we start talking about the detail of PPE, we don't know just what, if any, PPE will be forced to wear by government when we reopen, whether that will be very prescriptive or whether it will just be like Denmark, where they've said, open, no masks, no gloves, get on with it. So, a lot of what we're going to say now, I guess, will be best guess, based on what other countries have done, and the view of our three health and safety experts. So can I just throw that open to you guys about things like face masks to start with?
Do I on that for the one of a?
Yeah.
Sorry.
So should we be providing face masks? Should we be paying for face masks? Should we be providing face masks for our staff and clients?
So the first thing I'd like to say about face masks is that there's a list of advantages and disadvantages to face masks. It's not as if they're all advantages. Face masks are a great place for coronavirus to sort of accumulate in a place that you often touch and is quite sort of, yes, it's an area we are able to touch. And so I think that we should remember that when we're using face masks. It's not just like you put a face mask on and suddenly you're a whole lot safer. If you're touching your face, if you're taking the face mask on and off, if you're putting the face mask down on the side, these are all creating problems that you wouldn't have if you weren't wearing the face mask. Obviously, when you're working very, very closely to people, like everyone will be who's working in a hairdressing salon or a barber's, then there's the advantage of that close proximity and the protection stopping you. I think it's important to put a distinction between respiratory protection, i.e. an FP3 mask, and just the face coverings. There's a big difference between the two. I think on balance, if you can manage it properly, then they are probably a good thing. My wife, she's a respiratory consultant. She wears face masks at work. She's a bit here or there as to whether they're of value in her day-to-day work. Obviously, when she's working in a COVID ward, she will wear them. She'll have a proper face fit mask and all the rest of it. But it's not a silver bullet. There's also the gloves that we talked about. But I think we'll move on to that maybe later. I don't know if John and Dom have any opinions on face masks and respiratory protection, etc.
I guess it's to sort of make the point that face masks and coverings are really about protecting other people from you rather than the other way around. That seems to be a commonly held misconception, but it's the other way around, somewhere. So I think that's important. I think also to look at WHO guidance, the World Health Organization, and what they base them on, where there's no real substantive evidence that in anywhere other than close contact situations, face masks or coverings are beneficial. So again, thinking about the application of them is really important. I did see some stats somewhere, I think originated on the BBC website. I can't, say that with absolute fact that they're true, but I think they give us a good indicator of, what they might help us to do. Face masks, so the face fit type, where there's an actual seal that Will was referring to, that used in hospitals on the COVID wards, they can maybe give you a 95% ability to retain the what would you say, within the mask. When you drop to face coverings, you're down to 75%, but you can still see why they're advocated in confined spaces like public transport systems and stuff like that. And then when you drop to a scarf is very, very low on the percentage of use. So I think it's looking at how are they used in other situations, and what are the chance, what are the actual chances of them of stopping the spread. And then I guess there's lots of different people who make face coverings and face masks, and they're not all made to the same quality. So you may have one with Armani on the front, which looks amazing, but where has it come from? How is it made? I think we've got to be quite mindful about where we buy these things from, and it's not just the act of wearing one. As with everything in life, it's the quality of it as well.
Yeah, okay, and I think that's a good point, John. And picking up on what Will said here, the importance of how to put on and take off any PPE that you may decide to wear, and that's something that we are advising salons to do before they open. So have a training day with all their staff, get everybody used to the new ways of working, get everybody used to the things they can and now can't do because of COVID. And that all needs to be in place before we start trading and open the doors to the public. Go on, John.
Gareth, could I just add one thing about face coverings and masks, which we've seen from other countries, is that there's an important bit in the guidance about contact time, and about where contact time exceeds a short duration. And I think in most guidance that's as 15 minutes. So where that, and I don't know how it goes with hospitals, Will, so please, throw in your bit there. But for example, in one of the other countries that I'd looked at, I think it was was France, where the contact time exceeds 15 minutes and people are working in close contact environments all day. That's when there was a risk assessed case to go to a face shield. So not necessarily saying that that's the approach we'll adopt in Britain, but it certainly has been done in other countries. And we have to bear in mind the duration of contact with different people in close proximity.
Yeah, and that reinforces Carly's point about beauty treatments as well, because there are some real challenges, both in hair and beauty, about wearing PPE and carrying out the treatment satisfactorily.
Because presumably it's a lot more face to face, isn't it?
Much closer, and potentially for a long time also. And until we get that guidance, I guess we're not going to know which treatments and which services we're not going to be able to offer. And I guess that again comes back to the risk assessment, which is that we may say some treatments we perceive to be too risky to carry out at the current time, until perhaps the R number comes down further or social distancing is lifted. And that's something, is that something that each salon owner needs to decide themselves?
Yeah, I mean, I think obviously there'll be guidance. So we don't know what the guidance is going to be, so we wait for that, and that will hopefully inform us. If it doesn't inform us, then we've got a bit of agency to do, to work out what we want to do with it. I think it's really important to not do this risk assessment on your own, and to engage your workforce and maybe even your customers, because it's their risk as well as yours. So it's important to sort of see what they're willing to do, and if as a company, as a business, 90% of the people you work with aren't willing to do a certain thing, then there's kind of no point sort of doing it anyway. So I think it's worth having that discussion with them, where the guidance is ambiguous.
I think that's one of the key points, certainly in terms of the risk assessment as well, is the involvement of employees and discussing with them sort of what's reasonable, what they think they're willing to do, or if they think the risk's too high. It's all about kind of a collaborative approach. I think it's not just necessarily just an employer doing a risk assessment saying, right, that's it. I think the involvement of the staff is quite important as well.
And they may pick up something that you've not thought of.
Yeah, absolutely.
Yeah. So Mel has asked, should we be highlighting in our risk assessments that face masks themselves have a level of risk?
Yeah, I mean, I think that's not unreasonable. I think if you think you're going to go down the line of having a face mask, then you need to have something in there about how you're going to dispose of them or manage them or put them on, or how long you're going to wear them for, etc. I think as soon as you start touching them and having to take them off, then they've probably reached the end of their life. Certainly the disposable ones. They're not going to stay with you for long with the disposable face masks. So I think the answer to that is yes, but don't go overboard with it.
No. Okay. And it always comes down to money often, but whose duty is it, and therefore whose cost is it, to provide the PPE, whatever that PPE is, for three groups, if I can? So your employed staff, your clients, and also then for the self-employed people. And kind of a subsection of that is, what about the self-employed people's clients, because they're not your clients?
I think that's quite an interesting one. I think certainly for people that are working on behalf of you or your organisation, you have the responsibility for that. For clients, I think it's a little bit. I think that needs to be a risk assessed approach again, but it's going to be one of those. You can maybe, if you're accepting appointments, inform clients to maybe bring their own if they've got it, because they might have something particular that they want to wear or that they prefer. But also, I think it's the New Zealand guidance. They say that they should also have some spare just for clients as well, just in case. But again, I think we're kind of second guessing what perhaps the government are going to set out in their guidance. So it's quite difficult, that one. On the self-employed and the self-employed clients, you just explain a little bit how that works.
Yeah, so quite a few salons would have chairs that would be rented by third parties, so it's for them and their clients.
Okay, yeah, sorry, I thought you were thinking about going out, being a peripatetic worker, but yeah, I think again that falls into the same as the self-employed. Well, the same as salon clients and self-employed individuals, if that makes sense. So I think, yes, the employer's responsibility and the salon owner is the employer.
Sorry, John, you're going to jump in.
It might be like setting your site rules, that how you determine the salon to be run, and then according to your risk assessed view, and then however anyone comes in to do it, they have to fall in line with the site rules as it's your premises. And then that's a way of sort of catching everybody. And then on the customer one, it was interesting. At the weekend, I was talking to my mother-in-law about, she was saying that she was really keen to get back for her next hair appointment. But she was saying that one of the big drivers for her was for the salon to be able to demonstrate that they were managing COVID effectively. And she was quite happy to take her own face mask along. And I just wonder how important that will be in terms of visibility of how you're managing it, how you're controlling it. Going back to what Will said about being able to visibly evidence your washing hands, your cleaning regime, the last time everything was cleaned, that will be a really important part of the customer-client relationship.
And I guess also, if somebody were to turn up without a face mask and your risk assessment said they should be worn and they refuse to put one on, we just don't carry out the service on them. We say, thank you very much, but no.
I think that's quite reasonable.
If that's what your risk assessment says, yeah.
Okay,
I think you can probably keep a few masks in under the counter that you can then say, if someone, we're humans, aren't we? We're liable to forget things, that there's one here if you want to use it. A clean one, obviously, an unused one, obviously.
Yeah, so there's a good question here from Debbie, which is, if clients supply their own face coverings, how can we manage how good they are? So if somebody comes in with a scarf, we think, that's 75%, as you say, John, coverage, but we think they should be doing something better. How do we manage that?
So the 75% wasn't for a scarf, Gareth. That was considerably lower for a scarf.
Oh, I see. Sorry, a scarf's even worse.
Yeah, considerably.
Right.
A face covering was 75.
Okay, so if they turn up with a scarf, because lots of salons, because it comes back to kind of a second part of this is whether we're going to be charging for PPE. So this is going to be a big on cost for salons because of the number of people that come in through every day, the staff and so forth. And so maybe people would say they'll turn up in their own poor quality face masks in order to try and save that charge.
My feeling, I guess, is if the government issues some guidance saying that people have to wear face coverings, then they need to stipulate what those face coverings are, and they need to give you an idea as to what that is. And if it has a CE mark or whatever, then it needs to have a CE mark. If they don't, then it's up to your assessment. If you want, you can write your own policy on what you consider right or wrong. It's difficult. You are advantaged, I suppose, as the way I guess you're sitting with your customers will be breathing away from you. So I'm not suggesting that's helping, but I suppose the person sitting in the chair is at marginally higher risk than the person cutting the hair. But you're still both at risk because you're in close proximity. There's all these considerations. Unless the guidance give you definitively what you are or aren't meant to do, then it's up to you to make that assessment. My feeling is that it'd be good for them to have something, and a proper face covering's better. But where we go, it's difficult for me to say, really.
Mel's just come in with a good point that I was just going to make as well. Is how are you going to cut hair if someone's got a scarf wrapped around their head? It's going to be quite difficult.
Yeah, that's right. Backwash the same, and so the face masks that go behind the ears.
Yes. Yeah.
But perhaps are the answer. I mean, I have seen pictures from other countries with the client.
Are you still, Gareth?
He's frozen. I think I'd just be wary about charging for PPE. I know there's a couple of questions that have come in on that. The law states that you can't charge certainly employees for PPE. So I'd just be careful if you build the cost in elsewhere without it being a specific charge for that. Then I think that would be a safer way of doing that, of introducing that. But just be careful if you're going to make a charge for a mask or something.
Gareth, maybe having something that you email out to customers before they attend with appointment info about what your expectations are when customers visit the salon might be a good way to introduce face coverings, so that you are encouraging people to bring their own, and also their expected behaviour and so on.
Yeah, I think that's a really good idea, John, to set out the new salon rules for their appointment. You know, for example, we're expecting there to be no waiting, so you come straight in at your appointment time rather than, and you know, don't be late, basically, which is the bane of everybody's life. I expect no shows will disappear because everybody's desperate, but people will still be late because that's just people, isn't it? Another good question, which was about disposal of face masks or used PPE, and so I'd extend that into gloves. Do we need to be looking at getting things like haz waste bins, or can they go into a particular bin just for that, or with the domestic waste?
Domestic waste is what I'd say, unless John and Dom have a.
No, I'd say same.
The virus doesn't live forever on the items. It's got, you know, depending on what the surface is, it differs. So it's not like if you put it in the bin, it then just starts becoming this living, breathing dustbin bag of, you know, dangerous COVID waste. So just thinking about the practicalities of it. So I don't mean to be flippant about it. I just, you know.
But I think it's a fair point, John, because, you know, it's not going to be possible for, you know, all of the salons. There are 36,000 hairdressing salons in the UK, Wales, and Scotland, Northern Ireland, you know, over 5,000 in the Republic of Ireland. There is not enough hazardous waste collection capacity for us all to be needing a collection every day. It's just, you know, it's not there. So just take it, as you say, reasonable.
I haven't seen in any other guidance that anyone's using haz waste collections. I'm not talking about hospitals here, specifically not hospitals, but I haven't come across any other guidance that says special waste arrangements are required for disposing of PPE.
I think it's because of that short lifespan outside of the virus that, you know, sort of, it's up to 72 hours on a hard surface, isn't it? Thereabout. 3 days on a hard surface. So on masks and paper and things like that, it's shorter. But I think, yeah, clinical waste is it's expensive and it's probably over the top.
Okay, that's really helpful. Thanks, guys.
What I would just add to that is to try and manage the waste so it doesn't build up a lot. You know, I mean, just sort of keep changing the bags regularly and getting them out of the salon itself, you know, into the waste, your trade waste bins at the back, or whatever you use, rather than sort of just allowing it to accumulate inside.
Okay, so we've got quite a few questions about how one carries out the risk assessment. We're going to cover that at the end, guys. So we'll talk in a bit more about how you can go about getting the risk assessment done and how these guys can help you get the risk assessment done to mitigate your risk. We've also got quite a few questions about plastic screens. So there's again a lot of fake news and a lot of rumour about the requirement for a plastic screen between each chair. and how that might then protect us if we're using a hairdryer. What's your view on the need for plastic screens between chairs?
So I'd revert back to the hierarchy. Obviously, a plastic screen is fairly low down the hierarchy. If you can distance and you can ventilate and you can do all of that, that should be considered first. A plastic screen has value to it. I don't have any data to prove how much value it has, but it does have some value. It prevents sort of the movement of air. If someone sneezes or coughs, that the plastic screen will stop it. Obviously, the plastic screen will have to be cleaned, and it will have to be managed. I can't give you specific data about airflows with hairdryers and the impact with hairdryers will have. I think they're of value. I think they offer people some comfort, which I think is of value. As John said, we shouldn't be just doing things for the sake of it. I think there is some value in offering people some comfort. So I think there is some value in them. You can see them in supermarkets. I go into a lot of construction sites where they've put them in. There's something a little bit impersonal about them, I feel. I think they affect communication. I've heard people sort of trying to talk through them, especially with face visors. They just stop a lot of sound, so it does impact on communication. But yeah, I think they're of value. I don't know if John or Dom, you've got an opinion on that?
I think that screens will be linked to separation distances, which will be linked to occupancy capacity. So what we see in shops at the moment and offices as well is a vast reduction in occupant capacity. So what screens are great for is when you can't separate by your 2 meters, you can add in a physical separation, which will do it. If you're already separating your chairs to 2 meters, the screen becomes less important for protecting the flow. I think there's lots of good reasons, like Will said, where you might want them for extra protection, you might be a confined space. I just think that the Perspex screen links quite heavily to once people are in a chair and they're not moving, you can maintain this 2 meter distance. Where people are moving around in a salon, in a circulation space, that is, I think, where it's maybe going to be harder to get your 2 meters. So I think it's about limiting an occupant capacity so you can move around and maintain 2 meters as best you can. And then if you decide that actually because of the layout, you're close together, then you may want screens. So I think it's linked to other factors. It's not just a choice of should I have screens or not. Some things I think they're not easy yes or no answers. There's a bit of grey area where we take a subjective view based on risk.
Yeah, and I think that's right, isn't it? Because, for example, something like a nail bar, you can easily put up a screen where people put their hands underneath. The risk is greatly reduced, I would imagine, by doing so. It's simple, it's effective. You cannot put a screen up at the backwash. It's just not possible.
Yeah, so they might be useful for certain applications and not others.
Yeah, okay. The question about ventilation, Will, you mentioned about the importance of ventilation being right up at the top of the hierarchy. Is it acceptable to force ventilation with things like fans?
Yeah, it's really getting fresh air in and stale air out. So fans are good if they're doing that, not really of much value at all, I guess, if they're just moving air around inside, perhaps even make it worse, I don't know. So keeping the door open, if you've got Ventex fans in the toilet, turning those on, making sure they're working. So getting an airflow through, it's not all right at the moment because it's hot. It'll become harder if the weather gets worse. Yeah, I mean, the other advantage of keeping the front door open is that people don't have to touch it. So you can prop the front door open and people can just walk straight in and out. And you've got your natural ventilation. So, yeah.
There's a particular paragraph of guidance, Gareth, in the government guidance about HVAC about air conditioning and ventilation units, which would be worth kind of sharing with your group.
Yes, that would be really helpful because Mel has just taken the words out of my mouth, which is, what about air conditioning units? Are they safe to use?
recommendation is not recirculation. It's switch them to fresh air in, so they're drawing fresh air in from outside rather than recirculating within the premises.
Okay. So if anybody wants any of these documents we mentioned about the New Zealand guidelines, or they want the air conditioning stuff that John's just been mentioning, please email me now or at the end of the seminar. It's gareth@goodsalonguide.com, and we can then send you all of the information and the packs that we have discussed. A good question about shampooing. So there's been a split, it appears, with the countries that have opened about wet or dry hair. The problem with only dry is it makes colouring almost impossible. Whereas I think Germany, they said everybody must have their hair washed. Do you have a view about increased or decreased risk with washing hair or not washing hair?
I mean, it might be. I mean, obviously, washed hair is going to be slightly cleaner hair, so that's a good thing. I guess the problem with the washing is you come in very close contact. They've got their head back, and I guess I can't imagine any scenario where you're not sort of face to face. So I think for me that would be the risk. You can't really. Yeah, it's a tricky one.
Is washing hair not like washing hands?
Well, washing hair is washing hands. You do yourself, whereas you're washing someone else's hair, aren't you? So you're.
But are you cleaning it? I mean, if there were.
Yeah.
I mean, you're cleaning the like you clean the surface. You're cleaning the hair. So surely, if you can mitigate the risk from person to person.
The advantage of having clean hair, in my mind, and it's only in my mind, doesn't negate the fact that you have to face the person to wash their hair. I'd have thought that the face-to-face would be worse than the fact that they had slightly cleaner hair. In my mind, whether you should do it or not, there's going to be a risk of it. I guess if you're both wearing face coverings and they're well managed, you've mitigated that. I think it's probably a conversation, unless government guidance comes out and says one thing or another, it's going to be a case of you saying to your clients, look, we can do this. You can either wash your hair, and if you think you can get to us with it wet, then we'll do that. That's an option, I guess. And you have the same discussion with your staff and just work out what you're going to do. Yeah. Okay. That's all I can say. Sorry,
the risk of aerosol, water in spray form as well. If you're thinking similar sort of controls on that you would adopt with Legionella and things like that, is the water droplets that are coming out when you're washing hair, and that is something to consider as well as a risk factor.
It's a really good question, and it's a really difficult question. And I think if you look at what's happened in other countries, the governments have mandated the decision. So we could probably have a debate all day about, be guided by the science. But ultimately, we'll probably be told what is acceptable and not acceptable, I think, around that particular issue. There will probably be, as we said at the beginning, a couple, 2, 3 particular issues specific to salons that will be really difficult to answer right now. So we can put forward, like a best guess thing, but it's hard to make a judgment either way. Well, you can't make a judgment either way right now.
And linked with the backwash is that often, an apprentice or junior might be doing the backwash, and then the stylist would then take over. Does having contact with multiple staff in the salon, is that something that we need to consider, or really, less so, because the person doing the hair washing is actually only with them for, certainly less than 15 minutes?
Definitely reducing the contact. So if you can do it all with one person, ultimately, that's, and if you do, I don't know if you do shifts, but having people work in similar shifts is also important. So people that work together stay together, if you see what I mean. that's a recognised throughout all the industries way of managing it.
Okay. Thanks for that. So we've got about good question about refreshments and magazines. So again, I know that in some countries they have said, you know, you cannot serve refreshments or provide magazines to clients, and others they just say carry on. And what's your view? What's your guidance on that? Assuming the government don't tell us otherwise.
I think what we're trying to do with all of this is reduce touch points. So if we're trying to reduce touch points, then offering teas or coffees and touching them and handing them to the people, it's kind of an easy one to cut out, particularly if people are not waiting in the salon prior to an appointment. So if it's a disposable water cup and you kind of grab the cup, take it down, the next one pops down and you only get one touch and throw it away, I think that's fine. But if we're looking at things that we can easily do to reduce transmission, it would seem that, you know, putting a hold on cups of tea for the moment is probably an easy thing to do.
Yeah, I mean, you've got that big bowl of sort of sweets at the entrance, which I guess, you know, everyone putting their hands in. That's one end of the scale, isn't it? And then you've got a sort of a, you know, as John said, you know, the plastic cups that come down, and there's a scale there, isn't there? I think if you can offer someone a cup of tea in a paper cup, maybe, and it's, you know, you're allowed to get takeaway stuff at the moment. So there is a precedent for it. You know, I think, and the government guidance accepts it, then you might go that far, but I certainly wouldn't go any further. We're not with, you know, China cups, etc. That's just my opinion, though, not a official government guidance.
And I guess that kind of is linked with Nikki's question, which is about price lists and service cards and appointment reminder cards, which is that, there's nothing that says you can't have those, but you might want to reduce their use to start with, and likewise with payment. Do you see there's any real greater risk in taking cash? Should we be going, you know, card only and even then contactless, or actually is cash okay?
I think we should be trying to go cardless. I think that, you know, if you get a lady that comes in, she doesn't really use credit cards, or a man or whoever, and I think it's fine to accept cash. I just think you just need to be aware of the risk and manage it accordingly. It's kind of up to you. I feel it's a little bit discriminatory, perhaps, to some element of the population if you say you can't use cash anymore, but that's a call for yourselves.
I think if you use cash, wash your hands afterwards. Wash your hands immediately, then you've dealt with it. Encourage card payments. That seems a sensible thing to do. That's what in line with other retailers. If you have to use cash, wash your hands.
Okay, yeah, and basically we want to take the money, so let's not make it difficult. Let's keep it safe, but let's take the money. You know, after this long.
You know, can you do prepaid? It's exploring sort of avenues like that, isn't it?
Yes, absolutely. You know, relatively cost effectively with systems like Shopify, you can set up an easy website to do some trading on, and it's not expensive. So good idea. Okay. As Nikki says, we want the money. Let's not make it difficult. Love it. And I think that pretty much sums up how almost everybody feels at the moment, which is, let's just get back to work, please. Let's do it safely, but let's get back to work. Okay, have you, Will, Dom, John, have you got anything further to add?
Just another note. I mean, I think lots of people have been in lockdown for a long period of time, and I think certainly, whenever I need a haircut, whenever I go and get my haircut, it's nice to have a chat. And so I think there's a great public service that you all offer, perhaps unintentionally. And I think there's going to be a lot of people who've, struggled a bit and I think it's a really important service, actually. And I think the mental health of your patients, although it's not your responsibility, is important. So that's just an added extra, really.
Well, I can't wait for them to open again because I'm sick of waking up like Albert Einstein every morning.
So there's one important area which, thank you for the prompt, Jodie, which was, of course, the detail of how to complete the risk assessment. We talked about hierarchy. So I think that, you know, can you give us any more detail about the steps they should be taking?
For me, I think it's breaking the whole process down into lots of different sections. So you've got the customer coming in, you've got the bookings, you've got the reception area, you've got the cut and the wash if you're going to do the wash, you've got sections on PPE and how we use it. And so breaking it down into a couple of sections. I mean, the New Zealand guidance does it fairly well, I think, so you could sort of use that. And then just looking through that, and then identifying a list of risks. So you put the risk in the first column, and then I guess how you're going to manage it, and then the people it affects. So you would have cutting hair. You've obviously got a risk to the client and obviously the employee, and then you would maybe identify the risks. So you've got the risks that are going to be maybe with the blow dryer, sending the COVID virus around, or cutting hair. Contact with the hands, washing of the scissors and the equipment that you use, and then you can put in sort of measures. So you might decide you go down the face mask route. You're definitely going to have to wash hands before you start. You're definitely going to have a cleaning regime for all the equipment you use and the seat, and then it's just important to look at the risk and the likelihood of that. So I think that's another point, actually. Risk is a combination of likelihood and severity. So, and I think it's worth looking at both of those, because we haven't really looked at severity. We've looked at likelihood a lot, but severity is really important. And COVID-19 affects different people in different ways. And so I guess if you've got some staff or employees that are elderly, then your risk assessment might look slightly different. And so severity is really, really important. So you look at the likelihood and the severity, and then you work out what your risk is. Sometimes people do it on a matrix. So they have down one side, they have 1, 2, 3, 4. So 1 might be very unlikely, likely, and very likely if you're doing 3, and then you'd have and then you can work out, if you see what I mean, from the matrix where you sit on that. So you could do that, looking at likelihood and severity, and work out the risk at the end of it. So that's your risk assessment. You've got the sort of qualitative part, which is the writing, and then you've got the numbers, if you like, which is, you know, made up by yourself. And yeah, and I think that's pretty much it. It doesn't have to be that complicated. And the HSE website's got lots of guidance on how you do a website, on how you do a risk assessment. And of course, we can help as well with that if you need help with that. Do you have anything to add to that, John or Dawn?
I think it's a good point about older customers. I think we haven't really touched on that at all today, and whether there's a policy approach that you could decide, Gareth, for your members about what you deem to be acceptable to take. You know, how old can customers be? Because clearly all the evidence says that over 70s are in the highest risk group, and lots of over 70s get their hair cut. So I think that's a really important point just to consider in the flow of business. The second point I just wanted to add was about risk assessment, is that first and foremost, this risk assessment is for you. It's your risk assessment to guide you in your business. If you write something down and you don't understand it, or you're not doing it, the risk assessment means nothing. So whatever you write has to be in your language, or whatever you use has to be in your language, understandable and achievable. If it's not, it's a waste of time.
Okay, yeah, it's about reality on paper being in the salon. Otherwise, it's fairly worthless. Okay, so there's quite a few people are asking for templates for a risk assessment, and would you just advise, if they want a templated form, that they could just get that one off, the standard one, off the HSE website? What I'd also add is these guys have very kindly offered to give Good Salon Guide members a discount on them completing your COVID-19 risk assessment. So that would normally be £195, and they're very kindly reduced that to 150. If you are interested in that, and for them to help you take some of that burden, please just email me and I will pass your details on to them. So
there's
again,
a lot of information on the website, Gareth, as well. There's a risk assessment template.
Okay, remind us of your website, John.
COVIDriskassessment.co.uk. Can you send it out or tap it down, Dom, or something? There's everything that all the templates and all the current government guidance is on there for you to have a look, play with yourself.
Hang on, I'm adding it as a closed caption if I can. So yes, so hang on. So everybody should now be able to see the covidriskassessment.co.uk web address, and also my email address will just follow beneath that as well. However, if you do want, as I say, if you do want them to get in touch with you themselves, please just email me and I will pass your details across. Has anybody, if nobody else has got any further questions, Will, Dom, John, thank you very much for your time. Very much appreciated. And
thanks, Gareth.
I'm sure there'll be some further questions people have, so please just ping them across to me and we can then ask them on their behalf. So thanks a lot, everybody. And just a quick reminder that our next Good Salon Guide webinar is on the 2nd of June at 11 AM. Details will be coming shortly on our Facebook and website. Thanks a lot.
Thanks,
bye-bye.
Bye.